Hi everyone, this is Aurelie Najm from Glasgow, reporting live for RumNow in Milan for the first day of EULAR. Today I learned a lot about many different topics, but there's one presentation that particularly caught my attention, and it was presented in the plenary session. It's the oral presentation 00006. And it talks about a very trendy topic at the moment, interstitial lung disease, and it really confirms some of the things we knew, but also more. And basically, it's study is a Scandinavian study from Provanenal, and they have been looking in 5 different registries: Denmark, Finland, Iceland, Norway, and Sweden. And they've been looking at incident interstitial lung disease cases in patients with RA and psoriatic arthritis, starting a biologic or targeted synthetic DMARD, and they've been doing this through hospital and death database linkage. And so out of above 37,000 patients with RA, 12,000 patients with PSA, and over 500,000 healthy controls, they've been identifying 330 and 400 ILD cases. And so it was quite interesting to see that, as expected, the ILD incidence in our patients was higher than the healthy population, with a hazard ratio of 10, and this was twice more than in PSA. However, in PSA it was still increased with a hazard ratio of 5, and there are quite a few data now talking about PSA and the risk of interstitial lung disease, which is quite interesting, whether or not this is related to smoking. And smoking was not really looked at in the study, so that's something interesting as well to question. But what was really interesting as well was that they looked into the effect of treatments, and so they had patients treated with methotrexate, some that weren't, and then some patients treated with many different type of biologics. And what we kind of knew already is that methotrexate really is not involved in increasing the risk in the study, with hazard ratio of 1. So it's pretty clear. Most of the other biologic and targeted synthetic DMARDs were also not associated with an increase in risk. It was reported a slight increase in risk with rituximab. However, it could be associated more than with the treatment, with the confounding bias because of maybe a different population, a more severe population, etc. So it hasn't really been addressed that way. So I wouldn't really take this for granted. But I think, it's fairly interesting. It's confirming also that, I think we should go on with methotrexate and really convey the message that, it's safe to use as well. And so, yeah, I think that was quite interesting, and I hope you find that interesting too. I invite you to tune in on rumnow.com for some more content, and I will see you around.